Hi, my name is Melody, and I want to present our project called the ETUDES Center, working with PIT, CCP, UPMC, and PITNet. We hope to work with you in order to help primary care doctors support youth who may have depression and suicidality. The ETUDES Center hopes to reduce adolescent depression through low-cost and sustainable interventions. The ETUDES goals are to match doctors' referrals to patient needs and preferences by innovative detecting and triaging, improve adherence to doctors' recommendations by engaging youth in treatment, and managing the care outcomes of teens experiencing depression and suicidal ideation when receiving treatment within pediatric primary care. Since the majority of teens who have died by suicide had their last clinical contact with their PCP, the ETUDES Center hopes to work with you and incorporate your thoughts and needs and combine our experience and methods with adolescent depression and suicidality with the GLAD PC guidelines. The guidelines are: 1. Embedded mental health care is the preferred mode of delivery of mental health care. 2. In screen-positive patients, PCPs should assess for comorbidity and collaboratively make a care plan with the patient and family. 3. PCPs should actively support depressed patients referred to treatment to increase adherence. 4. All depressed patients should have a safety plan. With these perspectives, we will add doctors' lived experience in the field. We have two key components of our ETUDES Center to help combine your experience with our research knowledge, in addition to 3 research intervention studies. The first is that we have employed faculty and researchers across PIT, UPMC, and community to bring their training and expertise together. This way, we can address the problem of adolescent depression and suicide with innovative technological methods. The second key component of the ETUDES Center is engaging stakeholders. Davina, my colleague, is conducting ongoing stakeholder focus groups to include the feedback and expertise of the providers, policymakers, and deciders, community stakeholders such as mental health advocates, and teens and their parents who have experience with depression and suicidality. In order to create interventions that meet you and your patient's needs, we have broken up our research into multiple phases containing different studies and steps. These phases will be conducted throughout our grant's 4-year timeline. During Phase 1, we will determine if each intervention we develop is feasible or possible. This is called the Open Pilot, in which we will test 3 different interventions to address the 3 GLAD PC guidelines and the 3 main goals of the ETUDES Center. The first is Screening Wizard, which aims to address the goal of detection and triage by supporting the decision of PCPs to make a treatment referral or recommendation based on the patient's needs. The second is Text to Connect, which aims to engage teens who have been referred to embedded mental health care. Text to Connect will offer personalized text messages to improve adherence to the provider-recommended referrals. The third is BrightPath, which aims to manage depressed and suicidal teens by engaging clinicians who will help guide teens through an emotional regulation and safety planning app called Guide to Bright. To pair with Guide to Bright, an online clinician dashboard called Brightboard will provide summary rates of symptomology for the clinician to monitor. In the second phase of our center, we will integrate all 3 interventions into one package and care pathway called iChart, or Integrated Care to Help At-Risk Teens. Assessment and Recruitment Center are our trained phone assessors who will manage suicidal risks during assessments and will assist in the collection of informed consent and research questionnaires. Furthermore, they will establish procedures for communicating any actions taken in the management of suicidal risk with the teen's embedded mental health provider. With your help, we hope to achieve these ambitious goals. Please let the ETUDES researchers know of your questions at the end of this song.